The Commonwealth Foundation in Pennsylvania did a study around the Medicaid program. Now that's not to be confused with the Commonwealth Fund. Commonwealth Foundation, as in the Commonwealth of Pennsylvania. $6.6 billion of Medicaid dollars are devoted to long-term care services. It's 40% of the state's Medicaid budget. So the first thing to look at is how can we rebalance Medicaid so that less of the dollars are going to skilled nursing and more to home health. But they figured even doing that was not enough to reduce the number of people on Medicaid and reduce the number of dollars being expended. So what else did they look at? Well, they looked to how can we reduce enrollees. Well, one thing is to not get to the point where people have to spend down their assets in order to pay for long-term care, and that's about educating the public about planning responsibly. The other thing they covered was, after someone passes on who's had Medicaid services, the shortfall on what Medicaid supplied and the actual cost of the care, they can actually come after estates for that. Most people don't realize that, and there are all kind of different rules state by state on how that happens. And so your inheritance that you think is coming to you may have to actually go back to the state if they're more aggressive in their recovery efforts. Obviously, they're also talking more and more about reverse mortgages and how that can provide equity to families to actually pay for long-term care. And of course, something we talk about all the time, buying long-term care insurance. The bottom line here, pretty obvious. The onus is going to be on your own self-responsibility to plan for long-term care. Because states are studying this. You don't have to look far to see the headlines about state Medicaid budgets in turmoil. And right now, there's not a perfect way to pay for long-term care. And even the Class Act that passed with health care reform is in danger of being rolled back. And frankly, I'm not sure how much traction that would have had either. So, plan ahead. It's sort of like, putting the money in the 401k plan. Well, maybe just take a fraction of that and put it towards something like long-term care insurance, especially if you're young. The premiums will be really cheap. Thanks.